Welcome to The Beautiful Bag. This is your host, LeeAnne Hayden, cancer survivor, and more importantly, Ostomy lifer. Each and every week, I'm going to be bringing a special guest or some inspiration for you and a few little stories along the way so that you can learn what life is like for us to be living in an ostomy and why we all think it's a beautiful bag. So listen in and let's get started. These testimonials are representative of my or our experiences, but the exact results and experience will be unique and individual to each person. The information provided herein is not medical advice and is not intended to substitute for the advice of your personal physician or other healthcare providers.
Well, hello, everybody, and welcome to this week's The Beautiful Bag podcast episode. We are back with Ask the Doctor. I have my colorectal surgeon, Dr. Ivatury, with us again today. Last time he was on, we talked about hydration and blockages, and that was on episode 64. So if you want to learn more about that, go back and re-listen to that episode. But Dr. Ivatury was here up in Dartmouth, Hitchcock in New Hampshire, and that's why he ended up being my great surgeon. But now he left us and he is in Austin, Texas in the heat right now, and he loves it. But he is the chief of colorectal surgery at Bell Medical School at the University of Texas in Austin. So Dr. Ivatury, welcome to the show.
Great to be here. Thank you for having me.
I love having you on the phone or having you on it.
And then for anybody listening, if you're in the heat, make sure you stay hydrated. You get dehydrated very easily.
You can, and go back and listen to the episode because he had great tips on how to get hydrated. So go back and re-listen to that episode if you haven't, because you're right.
That's right.
Hydration is key for everything right now.
Right.
Yeah, exactly. But this episode, I know we were just talking a little bit ago, and we're going to talk about for the listeners. We're going to talk this week about the differences between ileostomies and colostomies, and when should you see a doctor or a surgeon, and what are some kind of symptoms that you may be going through for different things, right? So let's get talking about that. Like, what is the difference between an ileostomy and a colostomy?
Yeah. So, it's a stoma again. I think I mentioned it before, but I think a stoma means mouth. And so ileostomy is part of the ileum, which is part of the small intestine. That part of the small intestine is called the ileum. That's why it's called an ileostomy. It's the last part of the small intestine, so that the entire small intestine can absorb all the fluids and nutrients that it can. And then you bring up an ileostomy, which is the type of ostomy made up by the small intestine part called the ileum. Colostomy, similarly, is made up of the large intestine part called the colon, which is brought up to the abdominal wall as well. And so that's when people have colostomies. That's when the bowel is, the colon part is brought up to the skin. So that's the main difference. The ileum, or the small intestine, absorbs the majority of the nutrients that your body needs. And if you have an ileostomy for usually over three to 6 months, the ileum takes over the fluid absorption needs that the colon typically does, but you can still get dehydrated with an ileostomy. A colostomy, the colon does most of your water absorption as well as some nutrients. The colon can make some vitamin D, for example, but you can get vitamin D from the sun and your skin as well. So there's many different ways you can do that. So just in general, that's kind of the difference between an ileostomy and a colostomy. We use ileostomies and colostomies depending on the disease process somebody has and where the disease of the intestines are. And so sometimes that's why some folks get a colostomy and some folks get an ileostomy.
I love that. And you said something too, like stoma, because some people have asked me, what is a stoma then? Like, you talk about a colostomy and ileostomy with a stoma, and you just answered that question because I still had no idea. But the stoma is the mouth.
Stoma is the mouth. Stoma is just a general term. It's like cereal, like the general term for cereal, but then you have all these different types. So stoma is just the general term for any sort of part of the body that's brought up to the skin or brought up out, where it's not typically there.
Right. there we go. So now we have an answer for what that is. So if anybody has those questions too, like everybody's like, well, what is the difference between those two? And what is a stoma? So now you know when you're having that. So what are some of the reasons? So I mean, people come to you for, Crohn's, colitis, cancer. What are some of the differences? Well, we know the differences between, having IBD or issues like that and cancer. But what's the differences between Crohn's and colitis? What's the major difference between the two?
So ulcerative colitis, colitis involves usually only the large intestine, usually the rectum and the colon, and spares the anus and the remainder of the gastrointestinal tract, whereas the Crohn's can affect any part of the gastrointestinal tract from the mouth all the way down to the anus. So ulcerative colitis essentially can be cured if the entire large intestine is removed, because you don't have the disease is limited to the large intestine. For folks with ulcerative colitis, it usually involves only the first couple of layers of the intestine, which sloughs off and causes bleeding, which is the most common symptom for ulcerative colitis. Whereas Crohn's can cause bleeding, blockages, narrowing of the intestines, many different types of things that can occur. So, and the difference also is that Crohn's, as it currently stands, is something where can come back, can recur, can be in the small intestine, large intestine, the stomach, and the mouth, and so forth. So Crohn's can't be cured and is generally managed with medication to prevent the inflammation, to try to reduce the chance of it, the inflammation causing damage, requiring things like surgery or requiring other stuff like that. So, colitis is, in essence, colitis is limited to a very small part of the intestine, just only the large intestine, whereas Crohn's can affect the entirety of the intestinal tract.
Okay. And when should, what are some kind of symptoms? Because I've talked to some people before where, there was a young girl that I spoke to a while ago, and she was talking about, she was afraid to talk to her parents. She was bleeding a little bit and she thought it was nothing. What are some of the symptoms, and when should someone seek out, help or look for some help?
Yeah, I think, you all know your bodies. So when something is off, that's certainly one of the times when you feel like something's not feeling well, that it may be reasonable to talk to your primary care doctor and get a checkup, maybe get some blood work. Bleeding from the rectum is abnormal. There's not a normal amount of bleeding with bowel movements or in between bowel movements. So if this lasts, more than a couple of days or a day or two, then it may be something to consider getting evaluated, because there's diseases such as colitis and Crohn's that can cause bleeding, as well as diseases like polyps and potentially colorectal cancer that can cause bleeding, and it can happen at all ages. So we used to think that cancer only happens with folks above the age of 50 or 60, but now we're seeing increase in the younger age folks with cancer. So I'm not to be alarmist, but just know that the bleeding from the rectum is not always just hemorrhoids. It could be something else. So it's good to get it evaluated. Most of the time, it's something like an anorectal cause, like a hemorrhoid or a tear in the anus, something called an anal fissure. But it could be something else, and we are very cautious, and we want to be able to check. We want to be able to check it out, make sure it's nothing more significant.
Right. So people should be more, proactive in that area of when they do feel something. And you said something like your body, when your body's off. And I think that we are always so busy running our lives and running around like crazy that we don't actually take time to slow down to listen to our bodies. And I think that that's an important thing that we need to learn how to do, is to slow down and listen, because your body's telling you, hey, listen, something's up, even if you don't have like total symptoms. And
the other thing, if you have bleeding out of the opening of your ostomy, where stool comes out, that's abnormal as well, and so that's something that you should also be aware of. If there's can be bleeding around where it's attached to the skin, and that can be from the appliance, it can be from just irritation, it can be from motion, all of those things. You all know all this. because of your own lived experience. But bleeding from the os, or the opening of your ostomy, is something that's abnormal, can be abnormal, something that can be checked out. Sometimes we put a scope through, like a scope, like a colonoscope, or a ileoscope through the stoma, to look and make sure there's not any irritation, there's not any other problem that can cause bleeding as well. So for folks that poop from their bottom, bleeding is abnormal, and when the folks with ostomies, when they bleed out of the ostomy, that's also abnormal.
Right, and you said something else too that I want to go back to is your stoma can bleed. How delicate is your stoma and for it to bleed, and how should it stop almost automatically if it is starting to bleed, or how much blood is normal to abnormal of something that maybe something scratched it, or
it's like it can be scratched, so it's like any other part of the body. It's actually fair. The bowel part of your stoma is more sensitive than your skin, but the skin around it tends to be pretty tough, because it's been you have the adhesive, you have the appliance that's on the area, so it tends to be thicker than what the and other potentially other parts of the abdominal wall, for example. But little bit of bleeding that stops on its own is reasonable. I mean, that happens. It may be that your stoma appliance is cut too small, and it may be reasonable for you to go see an ostomy nurse and get it resized, because people's body contour changes, especially if you were really sick when you first got your stoma, but now you're gaining weight, you feel better, you're becoming more healthy. So I would advocate, routinely seeing an ostomy nurse on a regular basis, just to make sure that the stoma is fitting appropriately, because that's usually the cause, is that the stoma appliance is too small for the ostomy. And it's kind of rubbing and irritating on the side of the bowel part of the ostomy. So the skin, to answer your question, the skin is robust, and the bowel part is, it's intestine. So it's not as strong as your skin would be.
Okay, that's great advice. And what would you do? So two things. You said stoma nurse, ask your stoma nurse. What if somebody doesn't have access to a stoma nurse?
So my understanding, is there are programs also from the companies that make ostomy appliances where you can call and talk to a stoma nurse. And that, I don't know whether you've had a podcast on that. And that may be something to promote, because I think we in Austin, we're starting our first outpatient ostomy clinic in the region. And so if you're in the Austin area, please come and see our ostomy nurse, especially if you had an ostomy for a long time. We'd love to establish care with you. But to answer your question, I'm pretty sure every company has a website in which you can call and talk to an ostomy nurse. And do you have any experience with that, or have you seen that?
I have. The only time I've ever seen an ostomy nurse was maybe 2 months after mine, and I went to see mine to how to irrigate, which I guess is abnormal to do so soon. But we know me, I'm just not normal.
You're advanced. You're very precocious. So
I do things my own way. I've never called an ostomy nurse, because I've never had any. I've been lucky. I've been blessed, I guess, where I've never really had any issues that I haven't been able to kind of figure out on my own, or Google answered a couple of things for me, or I just text you.
Yeah.
Just say, is this normal?
Is this normal? Right, exactly.
It's normal. I see somebody.
But I think getting access to an ostomy nurse is really important. And recently correct. You may have to correct this, but I'm pretty sure like the Wound Ostomy Continence Association had created kind of an ostomy bill of rights that said these are the expectations for people with ostomies, and I think that's really strong, and I support that very much, because I think we as surgeons make ostomies, and sometimes we don't follow up and make sure people have been taken care of afterwards with it. So I'm pretty sure that there are services though, and that may be something that we can look into afterwards. Maybe we can talk about it next time.
Yeah, absolutely, absolutely. And I do know, like you said, where people get their appliances. I mean, I do know from my own experience, Hollister does have, Hollister Secure Start Services, which is, they do have access to ostomy nurses. I don't use Coloplast, but I'm sure that they have it as well, and Convatec. So I'm sure that the rest of them do as well. And really, I know with Hollister, you can just go to the website and you can see Secure Start Services there, right there as well. And I can see you're looking some things up for me.
Yeah, I just wanted to make it's a United Ostomy Association.
Yep.
That of America that did that Bill of Rights.
Yep.
So just want to make sure I say that, give the right information.
Yep. Nope. That's awesome. And I love. They're actually right out of Maine, so I talk to them quite a bit. They are an excellent association and an excellent place for people to go as well. So,
yep.
No, that's fantastic. And then one of the other things I wanted to talk about today, might as well, because we're here, is a little bit more on like gut health. And I know we can probably go into a whole new podcast on that, which I want to do at some other time. But just what are some things that just a couple of things that people can do to make sure that they are keeping their gut healthy, protecting themselves from, reoccurrence. Like you said, Crohn's is always they'll have it for the rest of their lives. But, what are some things that people can do to just make sure that their gut stays healthy?
I think we're finding that people's guts are individualized based on the composition of many different types of microorganisms that are inside of it. So I can speak a little generally to that, in the sense that we know that limiting red meat, limiting alcohol, eating a diverse group of foods, so fruits and vegetables, whole grains, things like yogurt that have some good probiotics in it. These are all kind of beneficial for folks. With a colostomy in general, you can eat whatever you want. I give people regular, whatever their regular diet. So I encourage them to eat a high fiber diet, especially if you have a lot of looser output from your colostomy. Folks I saw a patient yesterday who had been told with a new ileostomy that she could not eat the foods that she likes to eat, fruits and vegetables, things like that, peanuts. And we generally do that for the first couple of months, but as you advance, first 3 to 6 months, you can start liberalizing your diet a little bit, taking small quantities, chewing them really well. So I would encourage people, even with an ileostomy, if you've had it for a while and you have been able to eat things like cooked spinach and those chops, cooked chopped spinach, things like that, then trying to diversify your diet to eat a diverse group of fruits and vegetables, I think is good. There are registered dietitians that typically are available throughout the countries and throughout the world. So, if you have questions about it, I'm talking to somebody who studied this for years, I think is beneficial. We have a registered dietitian in our clinic that we refer folks to give them the more kind of making sure not just the fruits and vegetables, not making sure the fiber, make sure the vitamins, the minerals, and all those things are being taken as well. I think, and then limiting the kind of the refined sugars, limiting the kind of processed foods, things like that, are beneficial for folks, I think, in general, whether you have an ostomy or not.
I love that. Yeah, because I got the best email from a listener last week, and I'm definitely going to have, his name is Dave. As I know he's going to be listening to this, so I know I'm going to have him. I want to have him on the podcast to share his story if he's open enough. But he sent me the most wonderful email about, listening to the podcast. He said, if you see a big burly dude driving down the road in North Carolina crying, just know I'm listening to the podcast and knowing I'm not alone. And then he was talking about gut health, like just listening to, need to take, sometimes we just need to take better care of ourselves. So just want to give Dave a little shout out. But yes,
yeah, you're not alone, Dave. We're with you.
See, I love it, and there's a community, there's a whole group of people around, and that's the biggest reason that I do this, and you do what you do. I mean, you're saving people's lives all the time, and I appreciate you a lot. You know that. I wouldn't be here if it wasn't from you. Well, from you, for you, from you. I didn't come from you. I came from my mother. But if it wasn't for you, I wouldn't be here right now. Me and my pain in the butt, 9-hour surgery.
Yeah.
So
I'm still sore from it. Just kidding.
I seriously taken that thing out. That thing was big. Anyways, so is there anything else that you wanted to, just leave the listeners with today? Because we kind of covered a bunch of things.
Yeah.
Is there anything else you want to leave them with today?
I mean, I would say that from a diet standpoint, it's not saying eliminate everything. I think when I talk to my patients, I tell them not to change so much all at once, because it's not sustainable. But it's not saying don't eat refined sugars. Occasionally, you do it occasionally. You're at a birthday party and you want to have a piece of cake, that's fine. But just be conscientious about the foods and start adding things that are better for you, and kind of that will be beneficial from a dietary standpoint. I would also say that it shouldn't be expected that once you have your ostomy that you should try to manage it on your own, right? So I think finding an ostomy nurse, finding those services. If those services don't exist, then I think demand in your community that we should get outpatient ostomy services. I think that's really valuable, and that's what we're doing here. Is having the first outpatient ostomy clinic in the region, so that folks can get care even after surgery, even if they've had an ostomy for 10 years, they can get those services. Because there are always new products that come out. There are always new things that come out. It's always good to talk to an ostomy nurse for sizing, your body contour changes, all of those things. So if that's something that exists in your community, then I would definitely use those resources. Not just when something's going wrong, but just from more of a preventive maintenance standpoint.
I think that's key, right? We go to we're supposed to go and get our annual checkups with our GP, right? So why not, have this as one of our annual have it scheduled annually to just go see an ostomy nurse, or just to have is there something new? Is there something better I could be doing, for my ostomy? So anyways, I love you to pieces. And thank you so much for being here this week. Truly, truly appreciate having you on. And we'll have you on again, because I know there's tons more questions people have.
Yeah, absolutely. I really appreciate it. Thanks for having me.
Thank you so much for joining us this week. If you enjoyed this podcast, get the behind the scenes at LeeAnneHayden.com/ostomy updates. And also, if you found this episode encouraging, please screenshot it and share it on Instagram. And don't forget to tag me and also the person who was on the episode with me. I occasionally will do special gifts for anyone who does do a screenshot and share it on Instagram or in your stories. Also, lastly, please go to Apple or Google, rate, review, and subscribe to this podcast to keep up with them every single week. I enjoy you guys. Thank you so much for being here.